Good day, everyone. In the second module in PE, we will be discussing the different common injuries encountered by officiating officials and the athletes, as well as the basic first aid that we can do in these different types of injuries. Let's start by defining what first aid is. First aid is an immediate and temporary care given to a person who has been injured or suddenly taken ill. It includes self-help and home care if medical assistance is not available or delayed. Ang first aid ay ang agaran at mabilisan na lunas na pwede mong gawin sa isang biktima sa isang emergency situation habang wala pa ang mga doktor. You can do first aid even if you're not a professional. Just be sure you know how the procedure is done. The following are the objectives of first aid or ang mga importanteng dahilan kung bakit kailangan itong gawin. First is to alleviate suffering or para mabawasan ang sakit na nararamdaman ng biktima. Second is to prevent added or further injury or damage, or para hindi na lumala pa o maging mas grabe pa ang sitwasyon ng biktima. And the last one is to prolong life of the victim, or para mapahaba pa ang buhay ng biktima upang siya ay umabot at magamot pa ng mas mabuti sa ospital. Now let's discover what are the common injuries encountered by officiating officials and athletes. Isa-isahin natin ang mga injury na madalas nangyayari sa mga atleta during their games. First one is sprain. This is caused by torn fibers in a ligament. Swelling and bruising are some signs and symptoms. Second is strain. This is a twist, pull, or tear of a muscle or tendon, which is a cord tissue connecting muscle to bone. Third is knee injuries. This can result from a blow or twist to the knee, from improper landing after a jump, or from running too hard or too much or without proper warm-up. Fourth is fracture. This is a break in the bone that can occur from either a quick, one-time injury to the bone, acute fracture, or from repeated stress to the bone over time, stress fracture. And the last one is dislocation. This happens when the two bones that comes together to form a joint become separated. The joint is described as dislocated. How will we give first aid to these common injuries? If you've ever hurt your ankle or had another type of sprain or strain, chances are your doctors recommended rest, ice, compression, and elevation. This is the RICE method. RICE method, as one of your first treatment, is a simple self-care technique that helps reduce swelling, ease pain, and the speed up of healing. You can treat minor injuries with the RICE method at home. You might try it if you have an achy knee, ankle, or wrist after playing sports. If you have pain or swelling that gets worse or doesn't go away, see a doctor. First step of the RICE method is rest. Pain is your body's signal that something is wrong. As soon as you're hurt, stop your activity and rest as much as possible for the first 2 days. Don't try to follow the no pain, no gain philosophy. Doing so with certain injuries, like a moderate to severe ankle sprain, can make the damage worse and delay your recovery. Doctors say you should avoid putting weight on the injured area for 24 to 48 hours. Resting also helps prevent further bruising. Step 2 is ice. Ice is a tried and true tool for reducing pain and swelling. Apply an ice pack, covered with a light absorbent towel to help prevent frostbite, for 15 to 20 minutes every 2 to 3 hours during the first 24 to 48 hours after your injury. If you do not have an ice pack, a bag of frozen peas or corn will work just fine. Step 3 of the RICE method is letter C, stands for compression. This means wrapping the injured area to prevent swelling. Wrap the affected area with an elastic medical bandage, like an ACE bandage. You want it to be snug but not too tight. If it's too tight, it will interrupt blood flow. If the skin below the wrap turns blue or feels cold, numb, or tingly, loosen the bandage. If the symptoms don't disappear right away, seek immediate medical help. Last step is elevation. This means raising the sore body part above the level of your heart. Doing so reduces the pain, throbbing, and swelling. It's not as tricky to do as you might think. For example, if you have an ankle sprain, you can prop your leg up on pillows while sitting on the sofa. Here are the activities you need to answer in Physical Education Module 2. You can answer this activity online in the given links. If you answered online, screenshot your score and no need to do an answer sheet. If you cannot answer online, just write your answers in an answer sheet. In this activity, just choose the best answer for each item. In this activity, you need to tell your opinions whether you agree or disagree with these 5 statements. Then explain why you agree or disagree. You may also answer this in the online link I posted here, or write your answers in an answer sheet. And this will be all the lesson and activities in PE Module 2. Watch for the next video, that would be PE Module 3, along with the activities in that module. Thank you very much for listening, and goodbye for today.